So pulmonary hypertension describes really a broad spectrum of diseases that all result in elevated blood pressures in the pulmonary artery. The pulmonary artery is the artery that connects the right side of the heart, the side that receives blood from the body, returning from the body, to the lungs. And that side of the heart really functions to boost the blood up to the lungs so that it can pick up oxygen. Pulmonary hypertension describes an elevated pressure in the pulmonary artery that leads to the lungs. So in order to diagnose pulmonary hypertension, the provider has to have a fairly high suspicion. This is a condition that oftentimes goes misdiagnosed. Typically, we see patients that present about 3 years after the onset of symptoms. We see that commonly in our clinic, and we see it commonly in the major research trials as well.
The symptoms of pulmonary hypertension are very non-specific, and the most common symptom that patients experience with pulmonary hypertension is shortness of breath, and that usually happens with exertion. In the early phases of the disease, this can be very mild. And I was trained at a place where pulmonary hypertension clinic is run by a pulmonologist. And Dr. Grant was trained at a place where pulmonary hypertension patients were taken care primarily by the cardiologist. So with our training background and with our experiences managing these patients, in our training, we quickly realized how the cardiology and pulmonary teams are interdependent in managing this complex group of patients.
They're both in this room at the same time, asking questions, and I'm extremely pleased. They've healed me. Well, they haven't healed me, but I'm fine, I'm good. They've done everything that they should do, I guess.
One of the lower parts, it would expand, not contract. So my blood was going, they say the fluids were going into my lungs. That's why I had a hard time breathing. I did not know it, and when he came in and said there's still something wrong with you, and I thought, well, maybe I'm going to check out soon because I'm older, but nope, I've got plenty of get up and go, and I'm going to get up and go.
So from a patient's perspective, I do think that this offers convenience of seeing two physicians at once. From a patient's perspective too, it allows us to gain multifaceted insight as to what is the etiology of the disease and how we can best help a patient. We see many patients with really several causes for their pulmonary hypertension, and it's through treatment of all of these causes that really allows us to better patient care, to improve symptoms, and hopefully provide quality of life back to our patients.
It's a peace of mind when you have them both there at the same time, working together, and I know that they talk together, and I feel 100% taken care of here. I love those two guys. They have really changed my life because I can breathe pretty darn good.